I'm going to say something very controversial right now, but it needs to be said. New patients who have spent time looking for a provider and a clinic to come to do not want to talk to an AI receptionist when they finally decided to pick up that phone and call you. What happens when they come across an AI receptionist is either they get frustrated because the system isn't set up well and they get rerouted, and a lot of times they get hung up on, or they pick it up and they realize that they're talking to an AI assistant, and you've instantly lost that personal touch, that credibility that comes with having a human voice on the other end of the line. And you don't want to lose potential patients who are coming into your clinic because of a tool that you're using. Do I hate AI? I don't. I think it's a great tool and it can be used in a lot of different ways. But I think that an AI receptionist needs to be used in the right way. And this isn't a video about that, so we'll get into that at another time. But this video is strictly about your new patients that have decided to call you. They don't want to talk to AI. They want to pick up the phone, and if you're not answering, they'll leave a message, and then you may have lost them in a different way. But you need to have somebody answering the calls and helping get them scheduled. If the first point of contact with your clinic is AI, you're going to lose a lot of credibility with them. And I don't care what anybody tells you. I have firsthand experience with this. I have helped several clinics test out AI receptionists. We've done deep dives into the data that goes along with it. We've talked to patients, we've talked to team members to get everybody's perspective on what's happening and what they're hearing. And it's not great. People get frustrated. They don't want to come in. The staff is having to explain who XYZ person was that answered the phone that sounded like a robot. It's a whole mess. And at some point, we may be there where we're having very real sounding people picking up the AI or the calls for the clinics and answering them and being very accurate with what they can do and how they can help. But at the end of the day, it's just not there yet. And I don't care how real you think your AI receptionist sounds, it's not real. And this especially is difficult for clinics that have multiple services and multiple things that patients might be calling about. It just gets really convoluted and makes it difficult to even program these AI receptionists in. Now, it's the hot thing. People are going to tell you you need it. You're going to try it out, and you're going to either love it or you're going to hate it. And the people that I have worked with, they don't like it because it didn't work. Like I said, we've seen transcripts between the patient calling in and the AI, and it was just a hot mess. So this is just what I'm gonna say. This is my experience. And if you've been a practice owner and you haven't experienced AI receptionists, or you're thinking about it, maybe consider what human elements you're ready to give up in your clinic that make sense and the ones that you're wanting to keep. Because, in my opinion, as a person that's been in marketing, a person that's well versed in healthcare, a person that has um, been a patient to many of these clinics, when I'm calling up, I want to talk to a real person, and I want to know that somebody on the other end of the line is actually a human that can understand what I'm asking, and I don't have to repeat myself 47 times just to schedule an appointment.